Sue Paker-Hall and Nigel Utton and myself, we're going to talk about the puberty blocker experiment that the government want to use. I think both of us, because of our professional backgrounds, for different reasons, have reasons for being deeply concerned by this. So just to start with myself, I was a teacher for 23 years in primary schools in England, 10 years as a head teacher. I left in 2014, basically because the government was planning on doing tests for 4-year-olds, which at the time I just thought was absolutely appalling. I think teachers now think it's normal, but it certainly isn't. I retrained as an osteopath in 2014 to 2018. And now I'm no longer able to call myself an osteopath because of disagreements with the General Osteopathic Council and the direction that they're trying to take the osteopathic profession in. So I'm currently working as a craniosacral therapist. I work with a lot of babies. I work with 92-year-olds and everything in between. So my concern on this issue with the puberty blockers experiment is particularly as a gay man. Many of us feel that had we been at school now, we probably would have been taking down the puberty blockers and trans route. And we're very upset and disturbed by that. So, Sue, would you like to introduce yourself?
I would, thank you. And it is an experiment. Calling it research is too benign a label for it, isn't it? Yeah, so Sue Paker-Hall. I'm in my 31st year as a psychotherapist. Well, I was a counsellor to begin with and qualified as a psychotherapist around 2010. It took me 10 years from actually finishing my psychotherapy course to qualifying. I wrote a book in the meantime and did a master's degree in something else and just took the curly route, really. My main areas of interest are anger and rage. I've published a book, Anger, Rage and Relationship, grief and shame, all from a trauma perspective, and the methodology is relational. So I'm a traditional psychotherapist, and I call myself that to differentiate myself from ideological activists that have captured my profession, to be honest. They dominate my profession. Unlike you, I'm appalled that we're experimenting on the most vulnerable amongst us. I'm lost for words, really. The idea of it just knocks my frontal cortex offline. And I just feel a duty, a safeguarding duty and an ethical duty. The do no harm ethic is foremost in my mind. To push back, to speak out and push, however unpopular that makes me, to have that conversation. I'm delighted to be having a conversation with you about it.
Yeah, I mean, I think one of the things that really shocks me is I've read the government protocol
Mhm.
that actually got approval, and it was just shocking that there's a psychiatrist, a professor of psychiatry, who's
Mhm.
doing an experiment on children as young as 10 years old
Mhm.
with the view of blocking their physical development, um, it, and changing their whole physiology at from the age of 10 in terms of girls, and I think it's 11, 12, isn't it, in terms of boys. And
On average, yeah.
just the thought that these young people, the young people that I used to teach, I mean,
Mhm.
they want to be astronauts, they want to be bus conductors, they want to fly to the moon. And then and what we're turning around to them and saying, oh well, you like playing with dollies, therefore you must be a little girl, and let's block your development and
Mhm.
allow you to explore being a little girl with no chance that you can turn back. And I've got a lovely story about that because I was at the Gay Men's Conference
Right.
recently, Human Gay Male Conference in London. We heard from a young guy called Michael, who
Yes.
he told his story quite openly, so I'll repeat bits of it here. He
Mm.
was a very effeminate young man, and he went to a gay nightclub and was raped by a man, deeply
Right.
traumatic. He turned to drugs and alcohol
Mhm.
and was deeply distressed. And the way he put the story was that all of his friends were so worried about his drug and alcohol abuse and the fact that he had had effectively, I suppose, a nervous breakdown of sorts, and they convinced him that he was actually a girl and that he should explore being a girl. And so he went to his GP, had a 5 minute appointment. The GP in 5 minutes referred him to the gender clinic. Now, no help with his drug and alcohol abuse, no help with the fact that he'd been raped. And over the next couple of years went through the process of hormonal changes almost to the point of surgery, irreversible surgery to have his penis removed. And thank God he met a guy who'd nearly gone through the same process, who said to him, look, are you absolutely convinced this is what you want to do? Because if you do, I mean, this is a guy who was in his late 20s. If you go through with this, there's no going back.
Mhm.
And I think that was enough to kind of trick his, not trick his brain, but get his brain to rethink the situation. And thank God he totally reversed that. Went to see his gender specialist doctor and said, look, I'm a bit concerned. I'd like to reverse this. And the gender specialist said, I don't know how to do that, which it's just absolutely, truly shocking. So he
Mhm.
had to fumble his own way through that whole process of coming off the drugs, these physiology altering drugs. Um, and thank God he's managed to get support from gay men who have been able to support him into being a gay man, which is what he is, and
Yeah.
living a life. He's an avid campaigner against any transsexual hormones or surgery now. And
Right.
hearing that story was just truly shocking. And the thought that they're going to be doing this to 10, 11, 12 year olds,
Mhm.
it's insane.
Yeah, absolutely is. There's so many tales of comorbidities being ignored, of neurodivergence being ignored, trauma being ignored. Um, there seems to have been a fast track process for transitioning. It's really very shocking. And I've come across a number of stories of women who've been raped who at the end of the day are fearful of being women because they've been raped and go to transition exactly as Michael told you.
And one of the things that Michael said, which was very revealing actually, was that when he took on this persona of being Caitlin, female
Mhm.
Caitlin, Caitlin hadn't been raped. So in his mind, he was able to separate off
Yeah.
Michael, who was raped, from Caitlin, who wasn't raped. And
Yes.
that's going to make me cry. But
Mm.
when he thought that when his friends convinced him and the medical profession affirmed that rather
Mhm.
than giving him support as a young man who'd been raped. I mean, I've written a book. I've talked openly in my book, Where Have My Other Mummy and Daddy Gone? I've talked about
Oh.
I was raped as a child, as a very young child, various different times in various different ways by men. And it would be very easy to have said to me back then, well, take on a new persona, become Caitlin, be someone who wasn't raped and change your gender. I mean,
Mm.
from an osteopathic point of view, I learned physiology. I studied physiology for 4 years. People often don't realize that osteopaths study the same physiology and anatomy as a medical doctor. And there are two sexes. There's a male sex and the female sex. It's very clear. All the
Mhm.
anatomy books, all the physiology books, it is
Mhm.
very clear. There's a
Mhm.
tiny, tiny minority of people where the genes aren't quite sitting correctly and they are maybe not one or the other, but they have, like you were saying, there are loads of comorbidities in terms of that. And those aren't the people that are the transgender activists. Those often are very quietly in the background, just coping with what dice they've been given in
Mhm.
life.
Mhm.
But yeah,
There's no other aspect of identity that we freeze frame, that we capture and say that's it for forever, and then make a brutal intervention about it. This baffles me.
yeah.
I've worked with young people. I've worked as a supervisor on a young people's drug and alcohol project, and I just know the fluidity of identity development. Um, and it just beggars belief that this one aspect, this one peculiar aspect, I would say, of someone questioning their sex has been kind of picked up and made hay with in this way, farmer profiting, their lifelong patients. Do
Yeah.
they know that? Can any of them give informed consent? I mean, 15 years and 11 months is the oldest that can go on to that the trial. And as you said, 10 or 11 for girls, 11 or 12 for boys. They have to have reached a certain developmental stage, Tanner 2. But can they give informed consent? Can they be fully informed? I mean, the very idea that puberty blockers are reversible is very questionable, and yet they are routinely told puberty blockers are reversible. It's just giving you time to wait and see. Well, I think therapy gives you time to wait and see,
Yeah.
without interfering with your your precious body.
Yeah.
Mm.
I'm concerned from the physiological point of view. As an osteopath, I see, well, no, I'm not allowed to say that. As a person trained in osteopathy, I see
Mhm.
so many patients now whose illnesses as an adult are caused by medication they were given as children. I saw a chap in the week who'd had asthma as a child. They'd given him steroid after steroid after steroid. Now his bones as a 40-year-old are not forming properly. He's got to have two hip replacements. This is purely iatrogenic. It's caused by the medical profession.
Mhm.
And to give puberty blockers to these vulnerable, in my head, by definition, they're vulnerable because they don't know if
Mhm.
they're boys or girls. Now,
Mhm.
I would say, I don't mind the word normal. Any normal child knows if they're a boy or a girl. Any normal parent knows that their child is a boy or a girl.
Mhm.
And so if that is not happening, then there is some dysfunction there. We used to use the word dysphoria, but I've noticed in that's not, that word isn't being used. Gender dysphoria isn't used in the study. They use some other word. I've forgotten what it is now. Are you aware of that?
No, no, I can't remember what
It's
it is.
I've got it. Gender incongruence.
Incongruence, yes,
Yeah.
yes, yeah.
So now, in my head, I have worked with young people with anorexia nervosa. And I just see these two as the same, that this is a person with anorexia nervosa. They look in the mirror and they see someone who's fat and they need to diet. We do
Mm,
not give them Ozempic to make them lose weight.
mhm,
And
mhm,
so why are we, a little boy who looks in the mirror and sees a girl, why are we giving him a drug to stop him being a little boy?
mhm,
It's just the Emperor's New Clothes. I just feel like the young lad in the Emperor's New Clothes that just screaming at the
mhm,
medical profession, the politicians, the
mhm.
education system, the social workers, just saying, look, can you not see how insane this truly is? And I think, to be honest, because I have spoken to quite a lot of them, they do, but they're
Mhm.
absolutely terrified to say so. And I know that you and I, purely by making this video,
Mhm.
friends I know who've done similar things have had physical threats towards them. They've had death threats towards them. Poor little Michael, this young lad up in Scotland, he's had death threats almost on a daily basis from the transgender activists because he's dared to say that he feels it was a mistake for him. And there is something very, very wrong there. And
Well,
society has been intimidated into not talking about it.
like I did a bit of research a few years ago about social activism that comes from the adult ego state
Mhm.
and social activism that comes from the child ego state. And the comparisons that were most powerful for me was the social activism of Martin Luther King and Malcolm X. Martin Luther King was all about peaceful protest, was all about bringing us together. how can we all live together? Whereas Malcolm X was very divisive and quite supportive of violence. And I see trans activists, the most vocal, the most aggressive, they're not coming from their adult ego states. They're attack, attack, destroy, destroy. Um, and I think they need to do a bit of personal work on themselves, to be honest.
Yeah.
They're not pro-social. They
No.
believe they are because they're looking out for this demographic of people, but they don't do it in a pro-social way. They do it in a very alienating way. It's very aggressive. Um, I am very careful about using the word gender these days,
Mm.
um, because of the linguistic manipulation, the linguistic sleight of hand that's gone on. We began with the word sex, and then gender emerged in sociology, which simply referred to roles, you know, gender roles we talked about. But that's been hijacked now, hasn't it? The word gender as an identity. So we've
Yeah.
gone from sex to gender identity, which is the little thin piece of whatever it is we're basing all this on, is a fictional made up concept, with no evidence base to support that anything such as a gender identity exists.
Yeah. And for me, one of the big questions is this idea of a mental illness,
Hmm. Hmm.
because gender incongruence appears in the is it the DSM, the Bible of psychiatry, the
DSM-5, yeah.
DSM, and it's
Let me just check that because I'm not
yeah,
sure. I'm not
no,
sure it does in that form. You carry
no.
on though.
My point really is that the experiment is being carried out by a professor of psychiatry. So we're accepting that this is a psychiatric issue, that the young people involved have a psychiatric problem,
Hmm.
and yet we're going to affirm that psychiatric problem as if it's real. I mean, a lovely example you gave me before we started was the idea of someone who thinks they're Napoleon. We're not going to dress them up as Napoleon and start obeying their orders. It's like it is totally insane. I cannot get the insanity out of my head of it. The thought, when I was growing up I knew I was a young gay lad from about the age of 9. Now, in my book, I talk about, was I gay because I was sexually abused, or was I sexually abused because I was gay? I don't know.
Oh,
I
how
don't know is
interesting.
the
Yeah,
answer.
what an interesting,
Um,
yeah.
um, Other people in my family were not sexually abused. So I do kind of think that maybe there was something in me that predatory men saw. Um, and up until recently, recently in sort of human history, I would have been put in prison or even given psychiatric help because I'm clearly mentally insane myself because I'm sexually attracted to men. We've now said that that isn't the case. I mean, whether it is or not, I don't know. But the difference, I asked one of my lesbian friends, look, what's the difference between us being called mentally insane and transgender people?
Mhm.
And she was very clear. She said all LGB, lesbian, gays, and bisexual people have ever asked for is to be treated like everybody else. That's all we've ever asked
Mhm.
for. Equal
Mhm.
treatment in the law.
Yeah.
Um, I've never asked anyone to call me by a different name, or I've never given them grief because they've misgendered me, or
Mhm.
I don't require them to use different pronouns for me. I just want to be treated the same as everybody else. And I
Mhm.
think that is a huge difference with the trans agenda, that the trans agenda is telling everyone else, you have got to behave differently towards me from everybody else on the planet. You've got to
Mhm.
use pronouns which are just ludicrous. I can't get my head around this. I've never had to encounter it. Someone said to me, "What would you do in your practice if a transgender person came?" And I said, "I would treat them with the same love and respect I treat
Yeah,
everybody else with. I have no problem
absolutely.
with them as a human being.
Yeah.
But if they turned around to me and said, 'I require you to call me they,'
Mhm.
um, I studied linguistics at university. I studied Russian and French and linguistics, and to
Um,
me, gender is a syntactic um, device used in languages. It isn't anything to do with somebody's sex or sexuality. So um,
mm,
I haven't had to encounter that yet because I've never had to. Um, I think I would have a real problem with calling somebody they because
yeah.
I would call them he or she. If they have an adopted name, I'll happily call them by their adopted name because
Oh,
it's our choice what name we're called. But don't make me pervert the English language and start doing stupid things with pronouns because
mhm,
I'm not going to do that.
mhm. Um, it's interesting. This hasn't taken such a hold in countries where um, there isn't a differentiation between he and she, isn't it? Dr. P in an interview with Benjamin Boyce talked about the Arabic countries. I mean, there might be other reasons why Arabic countries aren't taking on this ideology, but um, from a linguistic perspective, there isn't the scope for it.
Mm.
It is gender dysphoria that's in the current,
Oh,
which
it's still there.
so that's quite interesting that they call it gender incongruence in the trial description. That is very interesting. I don't know if you know, but GenSpect, Stella O'Malley of GenSpect, is campaigning for it to be repathologized. She's
Yeah,
boldly campaigning for it to be repathologized,
yeah.
um, which fits perfectly well with what you're suggesting.
Yeah, I mean, I would support that totally. Because I think if I think of Michael, because I heard Michael speaking last weekend,
Mm,
if I think of
mm,
him and his situation, he needed help and support. He
mm.
needed love and attention. He had been raped. He had turned to drug and alcohol. He needed support on those levels, and he didn't get any.
No,
The
that would
NHS
have been
singularly failed him.
that should have been the first level of intervention, shouldn't it? The
Yeah.
drug and alcohol. Um, yeah, I was thinking of I haven't got the statistics to my fingertips, but a big percentage of detransitioners were same-sex attracted and and not in the wrong body. You
Yeah.
know,
Yeah.
and that phrase "transing away the gay"
Yeah.
is very meaningful, I think, very meaningful.
Yeah, and I think in some societies, particularly evangelical Christian societies in America, parents are telling their young gay men, their young gay sons, let's transition you into being a girl, and then this becomes acceptable,
Yeah,
rather than accepting that their son is gay. Which
yeah.
to those, there were 140 of us in London last weekend, which I was really impressed with actually, because
Oh,
when I've tried to have these conversations with gay men, they are so captured by the gender ideology that they cannot see beyond it. Oh, you're being transphobic.
hmm
Well, I'm
hmm
not being transphobic because phobic refers to fear, and this isn't fear. Um, if there is a fear, it's fear of human beings being harmed. Um,
hmm
People say to me, there's a difference between children and adults. Well, I'm not convinced there is actually. I mean, certainly in terms of children, if we are quite clear as a society that adults cannot have sex with children under 16, then I think for me that's a line that we've drawn. And
hmm
anything below that, we should not be messing around with at all. So puberty
hmm
blockers, anything like that should be
hmm
criminalized.
hmm
Anything to do with sex with under 16s. I mean, personally, I think 16 is probably a little bit too low, but
hmm hmm hmm
certainly trying to mess around with their bodies and mess around with their future at that young age, they do. I worked with young people. They do not know what they want. You and how can you give informed consent
Hmm.
to a experiment that's going to affect you for the rest of your life
Hmm.
at the age of 10, 11, 12, even 15, 16? You can't. And the detransitioners that I've spoken to, they are very clear about that they didn't realize that they were going to this was permanent, that they couldn't just flip a
Right.
switch and come back again if they got it wrong. It's not like having a new haircut, is it? It's not like buzzing all your hair off and oh, I'll let it grow back again. It ain't
Mm.
going to. It ain't going to grow back.
No, no. Um, and it shocks me how matter-of-factly practitioners are speaking from an ideological framework,
Yeah,
as if it's fact.
yeah,
Like you, and I'm really glad to hear what you said about if you had a trans patient, you'd treat them with the same love and care as any other human being, as would I
mm,
as a psychotherapist.
yeah,
Um, I advertise myself as a traditional psychotherapist, and I think that signals something. So I don't tend to get approached by
mm,
trans clients. I did for briefly for a few months work for a local gender identity uh, clinic, that service, I think it would have been called. Um, I'm 15, maybe even 20 years ago. But the level of psychotherapy that they were requiring me to deliver was such a superficial level of can there were two men transitioning to women who were referred to me. Can they live as a woman? Are they comfortable in a dress? Are they comfortable with their makeup? Are they, it was such a superficial level that it felt so unethical to me that not to think about their history, what may have happened to them.
yeah,
And in this affirmative approach, we're not allowed to use the most fundamental psychotherapy questions like, when did you first feel like this? Or why might you think like this? Um, we'd then be accused of conversion therapy. Yeah,
wow.
yeah, yeah.
And Michael was telling a story that he now has a piece of paper that says that he's a woman, and he
Yes.
can't get it reversed.
Is that right?
Yeah,
You get a gender recognition
that's it, a gender recognition certificate.
certificate. Yeah.
And so for the rest of his life now, he is a woman.
It cannot be reversed.
No,
Oh my
apparently.
crikey. I
I
didn't
don't
know
know
that.
the ins and outs about the details of it, but it's just sort
Yeah.
of um
I didn't know about that either.
no,
I had no idea. But it's such a difficult issue for the therapy profession. Sadly, a lot of more traditional psychotherapists and counselors, um, because they're being required to affirm, are not engaging with trans clients or potentially transitioning clients. And it's so sad because it is the most experienced amongst us who are not working with this client group, who probably need us the most,
yeah,
with an eye on trauma rather than social influences, because the critical ideology just looks at social pressures and how identity is constructed, you know, at a social level rather than over years and years of child development and interactions with others. Um, it feels a very
yeah,
hollow approach.
yeah.
Mm,
And
mm,
looking at the protocol for the experiment that they're doing on young people, this puberty blocking experiment,
mm.
um, I could see nothing in there where they were going to talk to detransitioned young people.
Ah,
It was only I may have misread it, but it looked to me as if they were only going to look at this particular group of children. They were going to give puberty blockers to, or they weren't, and talk
mhm,
to them
mhm.
and their parents and do longitudinal studies on them. And then that was going to inform health policy for all children in future. but there was no discussion that I could see talking to young people for whom the whole process had failed, the NHS had failed. Now, in my mind, if you're designing a study, you have to speak to people for whom it has been a disaster in the past. And
Yes.
there are legion of these people
Mm.
who have gone through these. Thank God, not all of them have gone all the way through the process, but they've gone through parts of the process and then realized it was totally wrong.
Mm.
Um, I would question whether it's right for anybody. From a physiological point of view, I don't think we should be messing around with the human body and certainly shouldn't be
Mm.
messing around with our hormones
Mm.
because of the long-term effects and the effect on brain development.
I agree. I went to a GenSpect conference a couple of years ago. Sorry, a CAN SG um, conference a couple of years ago. There was little protests outside that had to be managed, but it was well managed. The police
Mhm.
managed it really well.
Yeah.
Um, and Dr. Az Hakim was the speaker there. I don't know if you've come across him.
No.
He's a psychotherapist or a psychologist. I'm not sure quite which, but he runs groups for young people who are questioning, questioning their sex. I call it body anxiety.
Yeah.
I think that's a kind of real term
Yeah.
for it. Um, and he has detransitioners in the groups, regularly in the groups. And he hasn't, well, this was 2 years ago. He hadn't had a single person that had gone on to transition. So, you're making a really important point here. The other side of the story is not being told, you know, not supported,
No.
don't know what to do with the NHS doesn't know what to do with them. They're a bit of an embarrassment because they're not an outcome that suits their rhetoric, does it? So yeah, yeah.
Wow. So this puberty blockers experiment's going to go ahead. Unfortunately, we didn't manage to make enough noise to stop it. There were
No,
petitions. It
I
did go to
think
Parliament, but
I think James Esses and Kira Bell are mounting a judicial review. Um, so it may start, but there's a possibility that it could be prevented.
yeah.
Mm, mm. And it's not going ahead with terrific support from Keir Starmer or Wes Streeting, is it? You know, they've really dodged. We'll
Mm.
leave it to the NHS, or
Yeah.
we'll
Yeah.
leave it to the researchers. They're not confident about it. I don't think they fully support it.
No, probably not. They're too tied up with Peter Mandelson this weekend. So, and whether Keir Starmer's even going to last through till Monday morning, I think. So,
Yeah,
as we're making this video today, but
exactly,
yeah.
exactly. Yes,
Um, I was just wondering, I think we're kind of coming to a close. I just wondered if
yeah,
it's worth signposting anyone watching this to organizations or books that they might want to read. Have you got
yes.
any particular thoughts on that?
Oh, definitely. Let's put some links in the chat. Um, my brain can't hold too many things at once,
No.
but Gen Spect comes to mind. Sex Matters comes to mind. Can SG comes to mind. Thoughtful Therapists, of which I'm a member, comes to mind. Critical Therapy Antidote. So those are kind of five big ones to kick us off with.
Excellent. A
Yeah.
book I would recommend is Lost in Transnation. And
Oh,
I was
right.
going to bring it downstairs, but my kittens
So,
distracted me before I could get a chance to find it. But
yeah, yeah,
Lost in Trans Nation, which is an absolutely beautiful book by a psychologist who, like you, had a vast experience. Her experience has been working with young people with gender dysphoria or whatever label we
right,
want to put on that.
yeah,
So that's
yeah,
one book
yeah.
I would recommend. For gay
And
people, yep, sorry.
no, you go carry on. Sorry.
For gay people, the two organizations I would signpost are the LGB Alliance.
LGBT Alliance. Yeah.
They've just started a wonderful campaign to sort of like a counselling service for young gay people who are confused and probably getting very bad advice from their teachers, social workers, and friends, so that there's a neutral place that they can go where they will be supported as gay young people.
We didn't even touch on social contagion, did we, as a
No,
factor? But
no.
it's rampant. Yeah.
Oh, absolutely. And the other
Mm.
one I would mention is Human Gay Male, which is a
Yeah.
great organization. I mean, there were 140 of us in London last weekend, which I found very heartening, of
Yeah.
gay men who are supporting gay men to be gay men. Um, so yeah,
Brilliant.
we need all of that. But
Dr. As Hakim, who I mentioned, he's written a book called D-Trans, and that's an excellent book. Highly readable, very accessible,
yeah.
very moving. Um, yeah. It's
So
great to have a conversation with you,
it's
Nigel.
it's great to have a conversation because we just can't, can we? The trouble is, as soon as you bring this topic up, you're bang, slammed down. You're being
Mhm,
transphobic.
mhm,
End
mhm.
of discussion. It's just very refreshing to be able to actually talk. Really
Very
appreciate you
refreshing. Yeah,
giving your
thank
time.
you.
And I'll put the
My
video out.
pleasure.
Let's hope lots of people watch it and it provokes some sort of debate, and hopefully it will encourage other people, but particularly therapists, actually, to step
Mhm,
forward and say, well, actually,
mhm.
I think this is bonkers too, because that's what we need.
Well, my main mission is not to engage with ideologues,
Mm,
but to support fellow practitioners,
yeah.
to embolden them, really, to embolden them to push back a bit more, but also to offer them the language, because the mainstream therapy uh, bodies, training bodies, professional bodies, the language has gone completely political now. They haven't got another language. They haven't got the traditional language, the old language, you know. Yeah.
Wonderful. Well, thank
Yeah.
you so much for this afternoon. We might make some more videos in the future. Who knows?
Yeah, let's. Yeah,
Been great
let's do
talking to you.
that.
Thanks a lot, Sue.
Thank you. Bye now.
Bye.